Hi, everyone. So glad to have you here today. It's a wonderful day here in Chicago. I hope it's great where you are as well. So, today we're going to do something a little bit different. We don't typically talk about specific tools or products on this podcast, but I think there's a space for that. I think that can be really helpful. So, today we actually have the pleasure of having some folks who work at SimplePractice. So, if you are a SimplePractice user, this might be a great opportunity for you to start to learn a little bit more. And if you're not, it might be a great introduction for you. So let me tell you a little bit about our guest. Today we have Dr. Lindsay Oberleitner. She's a PhD licensed psychologist, a licensed clinical psychologist, and head of clinical strategy at SimplePractice, where she applies evidence-based practices to drive strategic clinical decision-making and advocate for mental health providers. Throughout her career, she's worked at the intersection of addiction, chronic health conditions, and the criminal justice system, underscoring her passion for advancing interdisciplinary training and collaboration. Her academic background includes a PhD from Wayne State University, a postdoctoral fellowship and faculty role at Yale University School of Medicine, ongoing leadership positions on the American Psychological Association's Continuing Education Committee, and publishing over 40 peer-reviewed articles. Welcome, Dr. Lindsay Oberleitner.
Thank you so much for having me today. So excited to have the opportunity to get to join you.
Well, my pleasure. And folks, if you are not familiar with, I think we all know Yale, but to be a part of their University School of Medicine, to have leadership positions with the American Psychological Association, Continuing Education Committee, and publishing 40 peer-reviewed articles, that's a pretty darn good pedigree. That's not easy. I am new to APA governance, and I will tell you, it is a whole system. So I think the clinical acumen you bring is going to be deep. So welcome. I'm so glad to have you here today.
Thank you. Thank you. And thank you for such a lovely introduction. And, I think there's such a range of ways we all get our experiences, and not one less than the other, not one more than the other. I think we all have unique pieces and stories we bring to the clinical world.
I love that. You're a good human. I think if that's the way you look at the world, I like that. So, today, part of the reason we're having this conversation, and folks who are clinicians out there, which is, I think, pretty much our entire audience, but we have pain points, and technology can be both at the source of those pain points, but it also can be a solution to those pain points. So we're going to talk today about workflows, administrative tasks. There's all the insurance pieces, the documentation pieces, credentialing, blah, blah, blah. All of those things that it's not even blah, blah. It adds to people's burnout. And burnout, as we know, is kind of a big deal in our field. Part of it is, as we know, holding all that we hold for clients. But now there's a lot we have to hold for insurance companies as well. So hopefully your EHR system, electronic health records, if that's not a familiar term, is a solution to some of those problems. But let's dig in and find a little bit about SimplePractice and how maybe that can be a tool for you. So, Lindsay, what initially drew you to, or how did you get to SimplePractice? Because I read your bio and it doesn't immediately jump out to me to say, I can see how you'd land right there.
That's a great question. And it's definitely a journey, right? When we're all like, would I have envisioned this? Maybe not back in grad school, back in those early days. I'll say, through I think there were a few key experiences that really drove me to SimplePractice and to technology and mental health more specifically. I would say at one point, when I was at Yale, running a large clinic focused, it was a forensic addiction program that I was deeply involved in. And during that period, I was responsible for lots of rollouts of like, oh, hey, we're going to start using an EHR, except we're only going to partially use it. We're going to use it for notes, not for treatment plans. We're going to use it for this and not for that. We had a million different systems. At the same time, I had my own private practice managing these systems long before it was like steady. I won't give the exact year for my age, but long before we were like sure that EHR was the way to go, right? So I feel those struggles. I can remember sitting on the floor with records surrounding me because I supervise so many people and just being like, I can't even sign this many sheets of paper, let alone
Right.
review it all.
Let alone read them and understand and make meaningful commentary. Yeah.
Right? Like it's meant to, they aren't meant to just be check boxes, right? Our documentation's supposed to have meaning for us. The review's supposed to have meaning, and we get so dragged down. And then I would say, so that I held on to that memory, but I moved on to a couple other programs, helping to start an LADC master's program and training and another
And what is that? I'm sorry to interrupt you.
licensed alcohol and drug counselor. So it was an
Thank you.
addiction studies program. Thank you for that clarification. And in those roles, I loved what I was doing. But what I realized is I get excited by how do we make things that, like, I loved being in an academic setting or hospital or community mental health, that I had tools, I had people to talk to, I had the newest science, I had all of these things right at my fingertips. And then we don't always get that once we're out on our own, once we're in private practice, once we're in other systems. And I was like, I don't like this. Like, this doesn't
Mhm.
seem right. And technology is one way to fix it. And it's one way to fix it at a larger scale, which is what really excited me, is the scale
Mm.
at which you can say, I want to make sure this tool's available to everyone. Let's do
Mhm.
it. And it impacts more than just the couple people you're near. And to me, that's a real big excitement, right? We all need to know where we get the most energy. And for me, that's a big source of energy.
Mm. I love that, right? Because you can help people solve pain points on a grand scale. I mean, simple practice is huge. And so I don't know how many users you have at this point, or individuals or groups or systems, but I think it's the, if it's not the top EHR system for mental health practitioners, I'm assuming it is because it's huge. So that for you is exciting. And folks, we talk on this podcast sometimes about career trajectory. And to your point, you just never know where something is going to take you. This isn't what you went to graduate school for, but you found energy in it and you followed it.
That's right. That's right. And I think that's one of those things early at, like when I still meet with graduate students or younger students in the field, I'm always like, get the skills that excite you, because you just don't always even know what could be there in the future, right? And you don't know what trail will take you to somewhere new.
Exactly. Right. I'll tell you, sometimes people ask me, because I own a pretty large group practice, and people say, was that intentional? Did you think back when you were first a therapist that you wanted to have a large group practice? I thought, no, I wanted quiet and peace. I wanted to sit by myself in my own space with nobody else. I'd like just had it with people at that point. I think it was just a phase of life, but life takes us where it takes us. So what would you say? Again, we're simple practice users. I know what works for me with simple practice. For you, from your vantage point, as the person who really is in this clinical seat, what would you say are the solutions you're trying to bring to people?
I think if I would say one overarching, and then I'll get more specific, is like we really want to make sure it is such a cognitive drain for all of us to have to go from system to system to system to system just to get some things done that we need to run our practice. And being able to kind of pull that all together under one roof and really understand one roof, but like one technology platform as much as we can, to say, like, you know what, if that's a hard thing to figure out, let's bring it under, and you have those options, right? You have that ability to do it centrally. I think some of the things that excite me personally the most, though there's lots of little pieces I could go down, is at the size of individuals who use Simple Practice, we also have that ability with things like Therapy Finder to help kind of get connected across the field, right? Like I remember running a clinic and going I worked forensics, right? So going door to door with probation offices and parole with cookies. And I love that. And I love the personal connections. I hope technology can make that not a necessity. If you want
Mhm.
to do that and you love that connection, amazing. You shouldn't have to. Like we can build into those systems, right? With those who want that built in, right? To get that access, to get the name, like things like Therapy Finder out there in the world and connected to do those things.
So Yeah, so Therapy Finder is a good example. And folks, I'm not getting any money for this. I don't get a free month of Simple Practice. Believe me, that would be lovely, but that's not what's happening here. I think, like you, Lindsay, I want to make sure people have information and that they can understand the tool. So, what would you say makes Simple Practice different? What is Therapy Finder? And what does Simple Practice do that maybe Therapy Notes or MD Live or some of these other platforms don't?
Yeah, so Therapy Finder, thank you. And even for anyone who might be a Simple Practice customer already, it was once named Monarch, so maybe that sounds familiar. We are now
The
named
butterfly.
Therapy
Mhm.
Finder. But a tool like that I use as an example of how we can help connect is that we have things that you can build in yourself. It's your platform. Our goal is your independence of making a choice who you interact with and how, right? That drives us every day. And in that tool, though, you can set up online appointment requests if that's a part you hate. I've always hated screening phone calls, and I don't know, it's just something I am not good at. Like getting those online appointment requests, getting to screen, integrating all those tools so that if you're like me, you can use that as a tool that helps to ease that burden of letting people find you. I also believe deeply in the science of open access. And although in private practice, we're not going to be open access, it's a step towards it if a client can find you the moment they want you and schedule an appointment, right? I think that's a pretty powerful step on the client side. So I think where we sit different than other places, other people is at that size, we can make something like Therapy Finder more visible, more shared. We can connect into systems to say, like, hey, if this is something you want, do you want referrals from healthcare systems? See a future where we can continue to kind of build in those connections with
Mm.
clinician remaining in control over kind of where do they want that, right? Where do they want their own practice to run? Don't turn it on if you don't want it, but if you do want it, you can, and you can ease those burdens.
Mhm. Well, and folks, I think the data is becoming more and more clear that anything that removes what's called friction for people to get in, right? And so there can be clunky systems where people fill out a little form. We have this too. They can fill out a form on your website and it goes to you. But what if you're off for a few days and who's monitoring that? And then what's the turnaround time? And does somebody get back to them or does it get lost somehow in the shuffle? Or you can make a phone call and maybe somebody answers the phone or maybe you leave a message and maybe you have time to get back that day and maybe you don't. Those are things that are called friction. And what that does is in our modern day world, if I can have instantaneous access to something, that's likely where I'm going. So if you want people to be drawn to your practice, remove as much friction as you can. Now, I would imagine, Lindsay, you hear from therapists and you are a psychologist, so you get it, where people say, but wait a minute, I don't want just anybody to be able to pop onto my calendar. Are you kidding? What if it's a blankety blank that I don't treat or, whatever? So, how do people navigate that?
I think you're right. I hear this all the time, and it's fair, right? There are some people for whom this will not work, right? Like there are some clinicians, this just isn't the style. You have maybe a very specific area you work in, and you just don't want to do it, or you don't need that flow. But for many people, I think, the struggle is things that I often hear that are actually fixable by technology. Like, well, I don't want to end up with 4 intakes in a day. Great, set it where it can schedule one at most and shut them off, right? We can fix a lot of those things with technology to make it less of a burden. Because I would share that same concern, right? Like if I open up, 3 slots today, that doesn't mean I want to take 3 people in. Or if I
Right.
have slots open, maybe I only want them filled. If it's less than 24 hours, actually, please don't touch them. And I
Mhm.
think many times people are thinking like, oh, I have to be on the system and monitoring that endlessly. And actually, no, that's our job to build the tools for you to customize and make sure it turns off when you want it to turn off and you get what you need to do it. And sometimes we need to hear those things, right? Like I'll
Mhm.
say, "Here, you have my name if you're listening." Like you can reach out to any of us and be like, hey, Why not this? Like, we're always
Mhm.
wanting to hear new ideas and new ways to solve. Maybe there's a piece, even though I'm a clinician myself, that I haven't thought through that, like, oh, this would make it, I would use online scheduling, but not unless you do this. The one
Mhm.
other piece that I would share is we can see it on our own, on how we see the tools being used, that
Mhm.
we see the data to say that like online appointment requests, when someone enables that versus just kind of that inquiry form, the people are more likely to show up because it is an action and it's a true connection right at that point. So I felt it on all ends, right? Felt it seeking care for my child when it's like, oh, if I can't schedule and you're not getting back to me, I'm going to go where I can schedule.
That's right. That's right. And that, that ends up being the takeaway, I think, is that for a tool like this, you are open to the feedback of here are some ways that I would feel more comfortable doing this, but to say, I think it's just a bad idea. Well, okay, then people don't have to use that particular tool. But folks, I think please hear this, that friction, if you're having trouble filling your schedule, figure out where your friction is and see if you can remove it. And this would be a tool where obviously you can do that. And I'll tell you, I mean, so what that might mean is that this person is scheduling a time with you, but that might be a time where you get on the phone with them and you do an interview. You don't have to have them show up at your office or show up and, I mean, there's a lot of things that might need to happen, but you have removed the friction. They now have somebody they can connect with. So I think that's a really smart tool. So what else, what are some other specific tools that you've heard from therapists where they say, well, thank goodness, it's like the squeezable ketchup bottle. Somebody thought of this. This is great.
I think that's a great way. I love the question that way. What actually meets the level of squeezable ketchup? That's a pretty high bar.
Exactly. That's right. Indoor plumbing and squeezable ketchup. Great inventions.
I'll jump
Like the
to one of
teacup
the big
indoor
ones
plumbing.
that I do think, obviously, it's not right for everyone again. And we believe, you'll hear me say it again and again. I'll try to stop saying it because hopefully it comes off clear. Like what we believe is building tools that people have the choice to use or not use. So what we've seen is things like our AI note taker. Because we've built in, and again, in the same way, wanting to hear how do people want it. Not everyone wants a tool that listens to a session. If that doesn't work for you, of course, that really reduces the most friction for you because a note's created and you can review it. But if you want to use dictation and you just want to give a summary of what just happened without ever touching the session and then have a note created, I mean, that outpaced what we hear the fears. I feel those concerns that we need to do this safely and cautiously. And I think that's been a real source for those who want to give it a try of solving a real problem, right? I already shared, I can remember the days of sitting with files just around me. Not a happy memory, but those notes can really do us in. And I'll share, like, even as we've developed it, and I've been very involved in the process of like, how do we think about it? What's it allowed to do and not do? And what should it never fill in the blanks with? I think within that, those cautions are the really important piece that you can trust it. And I do believe, and not everyone may be with me, but I actually think that the note-taking part of our process is really important. It's not just a burden, it's actually our reflections on a session. And what I love hearing is that for some clinicians, what they've found is they're able to reflect more because they're not just racing to the finish line to get things on paper. They're stepping back, they're seeing what came up, they're editing it. And it's like a different way of processing what you just did in a session. So I've been really excited to see the impact that's had for those for whom it's a fit,
Mhm.
right? For those who want to consider AI in their work.
And, folks, I think AI is not going away. And how do we utilize it in an ethical and meaningful way? So, the question I get asked from our team when we've talked about the AI note taker function is, well, what happens? Does it really evaporate after I'm done with it? Does it really go away? And do they sell this information? And are they using it as a learning tool to train automated therapy? I mean, those are everybody's fears. When I go into my doctor, they every time say, even my gynecologist last time said, is it okay if we have this note taker? And I'm like, well, okay, a little bit of a leap of faith. But so what would you say in terms of those concerns? So is it used as a learning tool? Does it really evaporate? The concerns that everybody has.
All fair concerns, right? And in fact, those are concerns when I've taught courses and I've presented alongside our chief legal officer at SimplePractice, and I went to ACA and presented, like, how do you consider tools and what do you ask kind of from our own expertise, not even just from the perspective of SimplePractice, but we're both there overseeing how these things get built and implemented. And the things I would say is you should always ask, right? Where is the data stored? How is it stored? Is it stored safely? And when does it go away? What controls do I have to turn it on and off? And to answer some of those, so believe deeply that everyone should ask that, right? We shouldn't be using any tool out in the field without getting the answer. Feel like it's just a line. We can't do informed consent with our own clients if we don't have the answers ourselves about those core pieces.
Oh, well said. Well said.
And so as we've thought through kind of what those pieces are, I'll say in, just in our note taker tool. So for anyone who's been using it, automatically what happens is any voice recording, the minute it transcribes is deleted. We have no access to that, right? It transcribes, then it creates a note. That transcription of a session doesn't go away for anyone until they sign the note or 7 days. Actually, the 7 day part was a hard one because we did hear from some clinicians are like, I don't want you to delete the transcript yet. I haven't signed it yet. And we're like, for safety, we actually believe it needs to go away quicker than that. So we actually drew the
Okay.
line where because we want it separated. And then at that point, it's fully in clinicians' control over whether if they would like everything to completely disappear, no record on our system at all, it completely disappears. They have that option at the clinician level. They have that option to say, no one I ever touch. Does anything get stored? You have the option at the client level. You have the option at the session level, just in case you ever change your mind or we're like, well, build it all the ways. For people who are willing, what we do store de-identified, decoupled transcripts that absolutely have no tie to clinician or client, only with clinician allowing that to go on because you're allowed to opt out at any point.
And I'm sorry, what do you do with those then, those that have
Yep.
been stored?
So those I can talk from my own experience of what we've had to do. So we've come a long way from this beginning before I share this tidbit. But when we first started with Note Taker, it was literally built on mock sessions between me and product. You have to build somewhere, right? However, that never matches the complexity of what a note actually needs to be created from, right? And the same thing that we've worked with, which is AI can create transcripts that we can then test. And I'll tell you the same thing. Sometimes I'm like, if I were to show all of us would have okay, yeah, that is CBT, but I wish it was that beautiful. Oh, that sounds great. I'll do that tomorrow, is not how most of my sessions have gone.
Exactly.
So it really is for a very specific set of being able to test and improve the prompt. What we don't do is we're not training an AI model. That doesn't go outside of our system. In fact, all storage doesn't go to any external, even though obviously we have to have systems to manage pieces. Those are internally based. We pay for that to be internally restricted data that never leaves our system and only accessible for that purpose internally is like, how do we build a better prompt to be able to say, AI, do it this way because you're still doing it wrong. The way suicidality is discussed, the way that emotions are. I'll give an example of something that AI can get wrong when it's something like in a session, someone says something like, did you have a good week? And client says yes, and AI interprets it as client reports feeling well. And I'm like, no, it doesn't. No, that's not what it does. And being able to clarify that, only if client shares the feeling in this way. So it's subtle things like that need caught and fixed that aren't represented. But again, everyone has full control to turn that off and be like, you know what, I don't trust that yet. Or it doesn't work for these clients, or it doesn't work for me in my practice.
So it's an opt-in for SimplePractice to be able to, or it's an opt-out, maybe for SimplePractice to be able to utilize that session information de-identified, no client information, no therapist information to improve the functionality of the AI so it gets it better and does a
It's a
better
better.
job. Yeah.
Because we all know AI AI is a great assist. It is not, it is so far from being able to replace the judgment and expertise in which we sit in, right? To be able to sit over that and be like, nope, that's still not right. Nope, that's still not right.
Mhm.
That prompt needs to ensure. And it's really, we're committed to that human in the loop, even internally, to say, myself and team, like, they need reviewed regularly what we're able to do and how the prompt is working and how it's drifting or not drifting.
It's wonderful. I'm relieved to hear that you are on the case, that SimplePractice and you, it sounds like you specifically, are assisting in making sure that this gets better all the time. In part, it's a better product, easier to sell when it's better, but also we have certain ethical standards in the field. And as a psychologist, that's part of your job, I'm assuming, is to make sure that those are all being respected and followed and adhered to. So that
Absolutely.
is wonderful. Anything else that you can think of? It, we're not going to be able to give it its due, but is there one other functionality? So far, we have the ability to schedule and get the friction out of the way. We have the ability to hopefully reduce our own burnout level by having the AI note taker and the ability to utilize it in a way that makes sense. And I did watch somebody use that on Simple Practice recently. It was pretty cool. They dictated it. The client didn't want the system turned on, but they did dictate it. And I looked at this beautiful note that popped out afterwards. And as someone who has to review notes around here, I'm like, that's nice. It can be helpful with insurance companies to have a note that really is structured properly. But boy, we have to read every word. It's no shortcut. You've got to read every word. She said it's not shorter, it's just cleaner. So I thought
Yeah.
that was a great way to think about it. So,
It
yeah.
takes away
So,
that's how I like to think. It takes away mental load so that your energy, I love that idea that I've heard from other people, so I'm not going to own it, that your reflections are on the deeper reflections and being able to
mm,
review it rather than that time being spent on the like, hurry up and get it down.
right, which is those notes are not as good. And we need to make sure that it's clear that this client isn't sitting with a friend chatting. So, yeah.
Right.
What is one other big piece of functionality that you think Simple Practice does for us that maybe somebody else does or doesn't, but that you're really proud of and think is super helpful?
I'd say one of the areas that we really have and continue to really focus in on is making billing easier. That is no one's favorite part, at least no one I know, no one's
No.
favorite
Mm-mm.
part of practice. And whether it's being integrated, if you have continuing to find ways, if you're doing private pay to make it easier and to make those reports easier, we are really trying to make that cleaner and easier process. But also, if you're working with insurance, you've seen maybe that we've tested things like integrating ways that through our platform, you're independent. Again, that's our core that drives us every day. But
Mm.
credentialing tests to like, can you just do it? Well, within a system, again, just push out, get what you need done, get the paperwork done. But then also things like billing insurance, finding out, interpreting how many of us struggle when this is probably not a proud admission, but I'm going to make it anyways, which is when I was running a program. I can remember at the end of every month, I'm like, I'll wait for the rejected ones to go back and fix.
Right,
But sometimes I'm
exactly.
like, I don't even know. I don't even
Right?
know. I've come a long way, but I was there at one point, and I
Mhm.
think that's something that we've continued to build is like, how do you even interpret what those rejections mean, right? Like, how can we continue to
Right.
build and grow into the space to take away the pain of what does this even mean? And it shouldn't be this hard within billing and insurance billing in particular.
Hmm. So would you say that's something that is evolving? And if I get a rejected claim, is it pretty clear? Can I figure out pretty quickly why that claim was rejected and how do I do that?
Yeah, I think it's something you'll continue to see us. We're investing in a lot of how do we build in these better tools. What we hear is that's a huge pain. What we know we need to fix is that, and we're getting better and better at it. So I hope what you'll see is month after month, this getting better, this getting easier, these understandings, these tools of how to do it, getting stronger on the system because there's no reason like in the annual report that we had out this spring, I think one of the things that always strikes me is how few people said they had any business training at all. Like almost half said zero. I got zero in advance. So I got zero. I got the antithesis, like the opposite, like less than zero when my
Less than zero,
program
right?
was,
The
don't
opposite of
do
it, right?
that. You don't, that's
Mhm.
not the pathway to take, right? So I think that it's one of those things that we just feel deeply, and you'll see continued improvement in that space from us.
Great. Well, I tell you what, when that happens, if you or anyone else from your team would like to come back and share with us what those updates are, I would be thrilled to have you here. Because again, I think this is a tool that is used by a lot of folks. And the more we can know about it and what's happening internally, the better for us. So that's wonderful. So, Lindsay, anything else you'd like our listeners to know before we wrap up today?
Great question. The two things that I would like to make sure I've shared is just as a clinician working in a technology company, I think one of the things that I've noticed, it is the environment I have ever most felt like I really am working with people who are mission aligned, and our mission aligned is we want to support independent practice, whatever that means for individual independent providers. But that is like the core of why we wake up every day to reduce those burdens so that clinicians have a choice in how they practice and how they continue to practice. I think our report too, and asked like, what's the thing that you most love about practice? And so much of it was around things like, I love getting to do the clinical work I want to do, right? How many of us have been in systems where there was some top down about how you practice, not just your paperwork, but like how you practiced. And we want that to continue. That wakes us up every day. And being with a team that gets energized by that is really exciting as a clinician to see. And alongside that, what I'd say is we endlessly want to hear. All of this being said, we don't get everything right the first time, and we're trying to improve. And sometimes we're getting something out quick, and we want that feedback and we want to hear. And we do want to match it up and get to the right answer that fits the most people or allows the most flexibility so that it works across people. And we really are open to, I truly, last name Oberleitner is not hard. There aren't many of us. You can find me online, but truly an open door if there's chats that you want to have, if there's things you want to understand or have questions about. We want to get it right. I think that waking up
Yeah.
mission driven is like, we also want to keep innovating in a safe way that meets the needs of independent practices.
Mm, that's great. So your door can be open, and there are channels that are built into Simple Practice to submit a concern, a complaint, a question. But if somebody wanted to connect with you, what would be the best way to do that?
I'd say finding Lindsay Oberleitner. I'm the only one I know of on LinkedIn. You can
Okay.
find me there. You can send me a message. I love to connect and I love to hear what's going on for everyone. And I do my best to be around and make some rounds across some of our national org conferences. So always happy to connect in person if you want to find me online and we can find some time because it's what we're here for, right? We're here to make it
Wonderful.
better.
That's great. Will you be at APA this year?
I will be at APA this year.
As will I. So we'll get to meet in person. That's great. I will
Awesome.
stop by the booth.
That would be fantastic.
Wonderful. Well, Dr. Lindsay Oberleitner, thank you so much for joining us today and sharing some of this with us. And again, anything else that comes up, if you think it's useful for people to know about, get back in touch with us and we'll schedule a time to have you come tell our listeners about it. So thank you. Thank you, folks who have listened. Oh my gosh, the wheels come off at the end. Thank you, folks who have been here today listening. So happy to have you here. We look forward to having you again next time. Be well.